Hello, hello. This is Dr. Ken Berry. I was asked by Dr. Westman and by Glenn if I would go live on the page and talk to you guys for a few minutes about a few things that I know just a little bit about. For those of you who don't know me, I am Dr. Ken Berry. I am a board-certified family physician. I have a small practice that I've practiced in for the last almost 14 years now in a small Tennessee town called Camden. It's in between Nashville and Memphis. And I've worked in the emergency room, I've delivered babies, I've done a lot of family practice, I've assisted in surgery, I've done a lot of things over the years in my training and in my practice. And I just wanted to go live with you guys and share some thoughts that Dr. Westman and Glenn thought would be helpful to you guys, and let you know that you have more power than you think you do. One of the greatest things about the ketogenic way of eating is that you either learn or remember that you have such power over your own health and your own medications that you take or don't need to take anymore. You have such power over your lifestyle. And we tend to forget this. We tend to give this power to doctors, and then they turn our power into prescriptions that we then take for the rest of our life, providing billions of dollars in revenue and not really solving any of our health problems, but we just give lots of revenue to big pharma and big medicine and indirectly to big food, and then we wound up not being healthy at all, but enriching big pharma and big medicine. So I'm going to go through some stuff. I wrote a book called Lies My Doctor Told Me over a year ago now. And in this book, I kind of break down in detail a lot of the lies that doctors tell their patients. And most of these lies are well-meaning and unintentional, but that doesn't make them any less dangerous. It doesn't make them any less damaging to both your health and to your relationship with your doctor. And so that's why I wrote the book. And I'll be honest with you, I was telling these lies early in my medical career because I just didn't know better. If anybody's watching right now, in the comments, tell me where you're watching from. I always love seeing that. And if you want to share this in your keto group, in your low carb, high fat group, or on your personal page, you have my permission. You can share away. It doesn't bother me a bit when you do that. Actually helps me to help more people. And you guys you need to know what I'm up to. Let me tell you right off the bat, I don't sell products or anything like that. I just have a mission. I have a calling. I have been called to break the curve of the epidemic of insulin resistance, of obesity, and type 2 diabetes in America. In every small town in America now, there's a dialysis clinic, and that shouldn't be the case. In most metropolitan centers now, there is a clinic just for juvenile type 2 diabetics, and that shouldn't exist. There shouldn't be a clinic just for type 2 diabetics who are children. That shouldn't be a thing. That's entirely caused by our diet, and that needs to stop. It should be embarrassing to the medical community that there even is such a thing. It should be embarrassing to the average doctor that there's a dialysis clinic in every small town in America. That's a travesty. It's a shame, and it shouldn't be that way. And I've basically made it my personal mission to put an end to that, because that shouldn't be. There should only be dialysis clinics in metropolitan centers, because there should be that few people on dialysis. And if we can fix the standard American diet, then we can put an end to that. We can put those big corporations out of business. We don't need those if we eat the right diet. We don't need to have type 2 diabetes clinics for children if we fix their diet. And that's what I'm on a mission to do. So you guys tell me where you're watching from. Are you watching from a small town or a big city? Tell me the name of the city or the town or the hamlet that you're watching from. I'd like to know. So I'm going to go through kind of the presentation that I gave recently on the low carb keto cruise that I spoke on, and I'm just going to go through some ideas to let you guys know you have the ultimate power over your health. You have the ultimate power over your diet, and you ultimately have the ultimate power over your own medical care. And I'm going to tell you how you can do some of those things today. So basically, the first question is, what the hell's wrong with your doctor? That's the most powerful question that you can ask right now, to say, what the hell is wrong with my doctor? Why does he refuse to talk to me about diet? Why does he refuse to talk to me about what I should and shouldn't eat? Why does he just get out his prescription pad as his first tool? Okay, so what's wrong with doctors? I mean, and I'll tell you right now, there's no big conspiracy. Okay, you may have heard that, you may have friends who believe that, but I don't believe that. I've been in the middle of practicing medicine for over a decade. I've seen over 20,000 unique patients in my years. Yeah, the five dialysis clinics in a small town. That's like Twilight Zone. That should not be happening right now, okay? And with your help, I'm going to put an end to it, because I think that America's sick enough. It's time to turn the tide. It's time to start treating these chronic diseases with the only treatment that ultimately cures them or reverses them, and that's your diet, okay? Now, what's wrong with doctors? They're human. That's what's wrong with them, okay? They're human, just like call off, so I stopped getting the call notification because I just got one. So they're just human. All they know to do is to do what they've been taught and to work with the tools that they've been given. And so in med school, I got about 6 weeks of training on nutrition. That's how most doctors are, even if they're lucky enough to get 6 weeks. So we've been taught for years how to use drugs and how to use tests and how to use medical interventions. We get more and more training, and then when we get out of medical school, we get something called continuing medical education, that we get trained for the rest of our career on the latest medical procedure or the latest prescription drug from big pharma or the latest injection or the latest pill. We don't get any continuing medical education on diet, on nutrition, on any of that. And so therefore, that's not a tool that the average doctor's comfortable using. If you're a carpenter and you're really good at using a hammer, but you've never used a saw before, then every carpentry problem that you encounter is going to need to be hammered, because that's human nature. That's actually called the law of the instrument. And that's how human beings think. And it worked great for us 50,000 years ago, because if you knew how to use rocks to crack nuts and to crack skulls with, then you were great at using rocks. But if somebody else had some other tool, you had no idea how to use that, so you would fear that tool and you wouldn't use that tool. And you guys know, even like with warfare, you may have heard of Genghis Khan, and you thought, oh, he was a great military leader. Well, probably not. Really, what he did was he invented a new type of warfare, a new tool to use for warfare, and so he decimated everybody because he knew how to use this tool. The British Empire, there wasn't anything special about them. They just learned how to use a navy, and so they basically conquered the world with a navy. No one had ever had a navy like that before, with the extent that the British Empire did, and so that they conquered the world with that. And with diplomacy and other tools that they knew how to use that no one else knew how to use. So some doctors are great, but some doctors only know one tool, and that's their prescription pad, right? And so that's the only tool they know how to use. And so we have to educate them if we can, and if we can't, we'll just find a new doctor, because more and more doctors are waking up to, oh, I have more tools to use than just my prescription pad. So the laws of human nature pertain to your doctor just like they can pertain to you. And I'm going to go through a few of these laws briefly, and then we'll get on to what you can do to help me change the world. So the law of the instrument we already talked about. If a doctor only knows how to prescribe pills, that's all he's going to do. He's not going to talk to you about a ketogenic way of eating. He's not going to talk to you about low carb, high fat, because he doesn't know what that means. That spooks him, that worries him very much, because he doesn't know anything about it. Therefore, how can it be good, right? And so we've all got to start educating our own doctor, or finding a doctor who's already been educated to this way of eating. Now, the next law I want to tell you about is the law of remuneration. What this means is that if your paycheck depends on you not understanding something, then you're not going to understand it. But at the same time, if your paycheck depends on you understanding something and believing in it, then you will understand and believe in that, because we all have to keep the electricity on, right? We have to get paid. And so if up until this point it's worked perfectly well for a doctor, he gets paid if he writes prescriptions, then that's what he's going to do. But when he learns, oh gosh, I can get paid actually to recommend diet, to recommend lifestyle changes, then he'll also, sorry, got another call. So the law of authority, that's another law. And so you may have heard of Ansel Keys. He was a hugely popular researcher back in the 50s and 60s and 70s, and he's basically the reason that there are such drugs as Lipitor, Zocor, and Crestor. If it weren't for him, we would have probably never went down the road of the cholesterol theory of heart disease. But he made it popular to think that high cholesterol and saturated fat would lead to an increased risk of heart attack and stroke. Therefore, Big Pharma jumped on board and they started making all these medications that we are now household names thanks to all of the commercials, right? Another law of human nature is the law of the shortcut. So if a doctor's faced with, oh, I can write a prescription for Zocor for a patient and be out of the room in 3 minutes, right? Or I can sit there and try to talk to them about diet, and that's going to take 20 minutes. What do you think the average doctor's going to do? He's going to do that, right? And so the law of the shortcut is actually a good law when we apply it productively to our human existence, but it can also lead to us doing dumb things like writing prescriptions when we should be talking about diet. Another law of human is actually an association, and it's called association implies causation. Now, we've actually used this to our advantage in the past. We used correlation studies to basically show that if you smoke, you're at increased risk for heart attack, stroke, heart failure, and lung cancer. And those studies helped us a lot. But then also doctors have misapplied other correlation studies to show that, oh, well, I guess, if we do this, if you eat saturated fat, then you're going to have a heart attack. But when you go back and look at those studies, they actually don't prove anything, and they actually don't even show that correlation. Another thing that doctors are bound by that you may never have heard of is standard of care. So I'm in a small town in Tennessee, and if I'm recommending that people with high cholesterol eat the standard American diet and take Crestor, even though that's not going to protect them from heart attack or stroke at all, that is the standard of care. And so legally and malpractice-wise, I'm very safe in doing that. I'm never going to be sued for malpractice, and I'm never going to be chastised by my medical board or fined or put on probation for recommending, oh, you should eat lots of whole grains and lots of fruit, and you should take Zocor. I'm very safe saying that. Even though I'm not helping my patients whatsoever, I'm very safe giving that recommendation to my patients. Whereas if a doctor like me says, no, stop that Crestor, you don't need that, and you need to be eating a healthy fat, low carbohydrate diet like the ketogenic diet, I can actually get in legal trouble for that, and I can actually get in trouble with my own medical board, even though that is the right information that I should be giving you. And so that's kind of the dilemma that doctors are in. Even doctors who know about keto may be hesitant to recommend it to patients because they'll get in trouble for that. And that's going to change before long. I predict that within the next 5 years, you'll see medical boards starting to back away from that and not chastising and fining and putting doctors on probation for that anymore. Another law of human nature is that a big lie is easy to believe, right? And so if you're seeing a lie on television, like the television commercials for Lipitor and Zocor and Crestor, that makes it easier to believe. I mean, obviously that must be legitimate, or these huge multi-billion-dollar corporations wouldn't be spending their time talking about it, right? It wouldn't be on the cover of Time magazine that cholesterol is bad for you if it weren't really bad. Well, actually, none of those things prove anything. And now you may remember the 2014 cover of Time magazine that says, eat your butter. Butter's good for you. We were wrong about the cholesterol and the saturated fat thing. Now, when big associations like the American Heart Association, when they start pulling away from the big lie, because you may or may not know this, but the American Heart Association, if you read their guideline papers now, they don't mention cholesterol, like, oh, you shouldn't eat that. They don't say, used to they said you should not eat more than 300 milligrams of cholesterol a day or it'll increase your risk of a heart attack. That's been removed from the AHA website and from their position papers. And only people who are doing active research and reading these things know that. So even though that lie is not being told by the American Heart Association anymore, there are all these tens of thousands of doctors in America still repeating that lie. And I call this the echo of the lie. Even when the big dogs quit saying this lie, Big Pharma is still making money off this lie, and your doctor may still be telling you, you need Zocor because your total cholesterol is high. Total cholesterol has not been a molecule of concern in years for doctors who know. The American Heart Association stopped giving a recommendation on how much cholesterol you should eat. They're quietly pulling away from that lie, but the lie is still being echoed by perhaps your doctor, perhaps by your mother-in-law, perhaps by your next-door neighbor. They're still echoing this lie because they think it's true. But it's not true, and it's been known to not be true for years, but yet we're stuck with the echo of the lie. So the last law of human nature I want to talk about is sometimes less bad is thought of as good. And a great example of this is filtered cigarettes versus unfiltered cigarettes. And so if a researcher did a study and he said, I'm going to put 100 people on filtered cigarettes and 100 other people on unfiltered cigarettes. And he did a study over the next 10 years. He would find that the people who smoke filtered cigarettes do better than the ones who smoke unfiltered cigarettes. And so he'd write that in a study. They had 10% less lung cancer, 10% less heart failure, whatever. And he would publish that study in a journal. And doctors who know how to read those studies and read the entire study would say, oh yeah, okay, so unfiltered cigarettes are less bad than, or filtered cigarettes are less bad than unfiltered cigarettes. But what happens with these type studies is that the media sees just the summary of that study. And then their news story, either in Newsweek or Time or on CNN or Fox News, is filtered cigarettes are good for you. But that's not what he found at all. He found that they were less bad. But less bad does not equal good. And so many times, like for example, taking one of the statin drugs, you may not die of a heart attack, but you're going to die of something else. And so just because you died of liver cancer doesn't mean that the Zocor or Crestor protected you from heart disease or heart attack or stroke, right? Because you're dead, so you can never have a heart attack. Therefore, your risk of heart attack is greatly reduced by taking Zocor, even though you're dead. You see how that doesn't make any sense. So less bad is not the same thing as good. Now, let's talk about what you can do to change the world, to help me change the world. So it's the ketogenic way of eating, low carb, high fat, low carb, healthy fat. Those diets are the diet that human beings should be eating. And most of you probably know this, but I bet a bunch of you feel powerless to really make any meaningful difference in the mainstream conversation about this. What are you going to call CNN and say, stop putting on those Crestor commercials? They're not going to listen to you. So here's what you can do. We have tools at our disposal now that 20 years ago no one had. Okay? You have more power today to change this conversation than the average doctor had 10 years ago. What power do you have? You can spread the word. You can spread the word unlike any doctor could 10 or 15 years ago. So there's a website called pubmed.gov. You can go to this website and you can read any medical study that I can read. You can read any medical study that Dr. Westman has access to. You can read any study that the American Heart Association has access to. The Bible is no longer written in Latin. Okay, it's been translated and it's at pubmed.gov. The medical and health and nutrition Bible is no longer in Latin. Everyone can read it now. You can go to this website and you can Google low carb, high fat. You can Google ketogenic. You can Google standard American diet and research proving that that's the diet that we should eat. You won't find much there because there is no research that shows that, right? And so what you got to do is you got to start learning. You got to take your own health into your own hands. If you have high cholesterol or you have type 2 diabetes or you have insulin resistance or you have high blood pressure, you need to know what causes that. You need to know that it's not your total cholesterol. You need to know that it's not your saturated fat that you're eating. You need to know that Crestor is not helping you a damn bit. But I want you to know that. I don't want you to take my word for it. I don't want you to blindly take Dr. Westman's word for it or Glenn's word for it. Don't believe any of us. I want you to do your own research, your own self, because you can do that with two things, PubMed.gov and Google. When you're reading a medical study and you don't know what a word means, Google it. In 5 minutes, you can know exactly what that word means. Okay? And then you can start saying, wait a minute, it looks to me like that maybe insulin resistance and chronically elevated blood sugars and insulins, that probably leads to more heart attacks and strokes than elevated LDL and total cholesterol. And you know what? You'd be right. But until you know that, you're unsure whether you should say that out loud or not, right? But when you're following a page like this page, or you're a member of any of the Ketogenic Way of Eating groups, yeah, the magic pill, that's a great way to wake people up. And so I talk about something called powdered butt syndrome. And what that is it's really hard for you to convince your mom or your dad or your aunt or your uncle of something because they've changed your little diaper when you were a baby. They've seen your naked little butt before. So nothing you say really carries much weight with them. And so you may have to find another way to bring them into this way of thinking and this way of eating. You may have to share something like a movie called The Magic Pill. If you haven't seen that, you need to watch it immediately. And then you can start sharing that movie all over your social media, your Twitter, your Instagram, your Facebook, all those things, right? And so you can reach thousands of people with your social media. And you don't have to say the ketogenic diet is the only way to eat. Listen to me now. No, just share the magic pill. Share that movie on and say like, oh my God, I watched this movie. It's so incredible. I can't believe what they're saying. And just leave it at that and share the movie. If 10 people watch it because of you, do you understand you have changed the world a little bit by doing that? I mean, that's pretty cool, right? You can change the world. You can change the way people think about the standard American diet. And you can also change the way people think about the American Diabetic Association diet and the American Heart Association diet, because they ain't no better than the standard American diet, okay? So just keep that in mind. You have this power now with social media. With your Twitter, with your Instagram, with your Facebook, you can reach hundreds, if not thousands of people. So the first thing I want you to do is learn. I want you to watch videos. I want you to read articles. I want you to go to conferences like Keto Fest coming up in New London, Connecticut. You can go to that and you can listen to the preeminent thinkers on low carb, healthy fat, on ketogenic. You can literally become a local expert on this way of eating. I just came back from KetoCon and there were people there in Austin, Texas who just were regular guys, who were plumbers, who had a job at the factory, who were independent contractors, who were entrepreneurs. And they weren't trying to be an authority in this space. They were just trying to learn about their own health and then go back home and share it with their friends and family. That's how we're going to change the world, folks. That's how you can help me change the way people eat and the way people think about chronic disease in America and indeed in the world. You can help me do this. So once you've learned what you need to know, then you're going to start leading. And here's the best way to lead if it's your family. You can't go back home after you've learned this and you've heard the bell ring. And you can't go back home and say, Mama, stop eating that whole wheat bread right now. She's not going to listen to you because of powdered butt syndrome, right? But you can first of all lead by example, because any of you guys, if you've been eating the ketogenic way and you've lost a substantial amount of weight or you've cured some of your chronic diseases, people are watching you. They're looking at you going, what the heck have you been doing, right? You've lost a ton of weight, dude. You look so much better now. You used to want to be on the couch asleep, and now you're running around with all this energy. How are you doing that? And so when you lead by quiet example, people start asking you. And when somebody asks you what you're doing, even if it's your mama, if she starts asking you, hey, what are you doing? Then she's receptive to the message, right? Then she'll listen to you. But if you go home and start preaching to people who are not yet ready to hear it, you're just going to annoy them. So don't do that, right? You're going to lead by example until people start taking notice of the changes in your life, in your personality, how your depression's better, how your anxiety's better, how your psoriasis is better. And they're going to be like, dude, what are you doing? They're ready to hear your message then, okay? Does that make sense? You're going to lead by passive resistance. You're going to lead by not taking that statin. And when the average pharmacist in your hometown, when he sees that the doctor's writing all these prescriptions for statins just like they always have, but only 10% of the town is filling their statin prescription, the pharmacist is going to go, what what the heck's going on here? And the next time you come in and you're like, yeah, I'm going to get this and this, but I don't want that statin, he's going to ask you, what the hell? Why are you not taking your statin? He's receptive. And then you can tell him about the magic pill. You can tell him about my Facebook page or my YouTube channel. You can tell him about Adapt Your Life, this page, and say, you need to go check this out, dude, because this is pretty powerful stuff. And the pharmacist is going to be like, well, I mean, he looks great. He's lost 80 pounds. Maybe I should check this out. Then you just opened up another professional's eyes, because it's not just about doctors, right? It's about pharmacists. It's about physical therapists. It's about nutritionists and dietitians. All these people got to have their eyes open. They've got to hear the bell ring. And until they hear that, they're going to be closed, and they're going to have their blinders on, and they're not going to listen to you. They're not going to be receptive to your message. But if you learn and then you start to share, that's the next step, is to share your personal story. So many of you guys are kind of embarrassed about your weight, or embarrassed that you had type 2 diabetes and it was your fault because you were eating crap. Stop being ashamed. Stop being a shut-in. Stop being ashamed of your life. You've got to start being proud of what you've done. Have you stopped a blood pressure medicine? You need to share that story. Have you lost 20, 30, 40, 50, 60, 70 pounds? You need to be sharing that on your social media today. Not only that it happened to you, but how you did it. You can share the magic pill. You can share one of my YouTube videos. You can share a ton of Dr. Westman's videos. That's how you do this, is you lead by example, and then when people are ready to hear, you share. You share it on your Facebook. You share it on your personal page. You share it on every group you're a member of. That's how we get this message out, because I promise you one thing right now, and you can take this to the bank. Never is this message going to come from the top down. This is going to be a bottom-up grassroots movement. That's how this is going to happen. That's how we're going to change these epidemics in America. It's never going to come, you're never going to turn on CNN or Fox and they're going to say, well, a new announcement from the American Heart Association today, the ketogenic diet is the way you should eat. That's never going to happen, ever. Okay? Even when the majority of America is eating that way, it's never going to happen. The American Heart Association and the American Diabetic Association right now are very busy backtracking from saturated fat will kill you. Okay? They're taking stuff off their websites. They're taking down pictures of healthy breakfasts that include pancakes, orange juice, and some fruit. They're taking that stuff down. Okay, but they're never going to come and say, God, we're idiots. We were wrong for the last 50 years. You need to stop listening to us about diet and start listening to Dr. Westman and Dave Feldman and Jimmy Moore and all these other guys. They're never going to say that. Okay, this is going to be a grassroots movement that overtakes the American professionals. And until the point where doctors like me are like, dude, there's something to this low carb, healthy fat. I better Google this. Nutritionists, when enough people say, you want me to eat how many grams of carbs per meal? I ain't doing that. That's stupid. That'll make my diabetes worse. Then you just woke up a nutritionist, right? And when enough people say that, it's going to start to change. Now, if you're the first person that says it, you're a kook. Yep, you sure are. When you're the 10th person that says it, you must be part of some cult or something. I don't know, some low carb something or other. But when you're the 100th person to say it, when you're the 1,000th person to say it, when you're the 1,000,000th person to say it, that's a grassroots movement. That's what's going to change, and that's what's going to break the back of big pharma from just throwing a bunch of pills at these epidemics of chronic disease that will never be cured with pills. That's how this is going to happen, and you get to be part of it. This is a beautiful time in history right now. It's almost like we're coming out of a medical dark ages. It's almost like a medical renaissance, and it's not going to come from the top down, okay? We all heard the story about what happened to Da Vinci and Michelangelo when they started talking about the earth's not the center of the universe. It didn't go well, right? When Plato started talking about revolutionary ideas that he was absolutely right about, but that Greek society wasn't ready for, you can Google what happened to him. It didn't turn out well for Socrates. So none of the big dogs are going to say this because they'll get ground up in the gears. And so it's got to come from people like you and people like I. We've got to talk about this stuff, okay? We got to speak out. We got to not be ashamed of our story. We have to be proud of our story, and we have to share it, okay? So you share it by word of mouth. You can share it over coffee at McDonald's, where you won't be eating the McMuffin. You'll just be having the coffee black. And did you know at McDonald's, you have to tell them you want your coffee sugar-free, or they'll put a little bit of sugar in there. Did you know that? Yeah, there's lots of places like that. Denny's, for instance, if you get scrambled eggs at Denny's, you have to tell them that you want eggs only, or they'll put a little pancake batter in there because it makes the eggs taste better. Did you know that? A lot of restaurants are like that, and so you have to start asking for things like that. And when you say, hey, I just want eggs only in my scrambled eggs, the waitress will be like, that's weird. I've never heard anybody ask that before. But then when 10 people are asking her that and 100 people, you get the idea that waitress is going to be like, huh, maybe that's bad for me. Maybe I should start doing that too. Then the manager of Denny's, he's going to be like, dude, nobody wants pancake batter in their eggs. I guess we'll just start putting just eggs in the eggs now. Right? You just changed the world a little bit. Your little corner of the world, you just changed the world. That's how you do this, okay? So, I just wanted to take a few minutes to talk to you guys about this and to tell you you're way more powerful than you realize. You've got the power to change your little corner of the world. And when enough of us have changed our little corner of the world, guess what we've done? We've changed the whole world. And that's how this is going to happen. That's how we're going to break the curve of type 2 diabetes epidemic. That's how we're going to destroy the curve of the insulin resistance and the obesity epidemics that are in the US, the UK, Canada, Australia, all of modern society. So if you've got a friend in Australia, share this on their Facebook page. If you've got a friend in Canada, share this video. Share Dr. Westman's video. Share some of my YouTube videos. Share my book. If you've got a doctor who thinks that eating saturated fat is bad for you, if you've got a doctor who thinks that your total cholesterol being elevated is actually a risk factor for heart attack and stroke, you could even share my book, Lies My Doctor Told Me, with him and wake him up, okay? So this is Dr. Berry, and I really appreciate Dr. Westman and Glenn giving me an opportunity to talk to you guys on this. And like I said in the beginning, feel free to share this video. I never want pay. I did this for free today, and I'll do it for free every day. What I'm trying to do is I'm trying to save eyes from blindness and kidneys from dialysis and legs and toes from the surgeon's scalpel. That's what I'm trying to change. That's what I'm trying to save, because I'm sick and tired of it. I'm sick and tired of seeing people on dialysis who never had to be there, and people on crutches without a leg, and the leg could have been saved. I'm sick and tired of that, and I'm just not going to shut up until we've broke the curves of chronic disease in America. This is Dr. Berry.